Okay, we're going to get started now. Good evening. Welcome. Thank you for attending tonight's Ahead of Cancer Conversation sponsored by the Allegheny Health Network's Cancer Center. My name is Michelle Stanicki, and I'm one of the project coordinators for the Cancer Center. There are a few housekeeping items that we need to go over before we start. During the presentation, all participants can type questions into the chat or Q&A portion of the Zoom. We will be addressing those questions at the end of the lecture if time allows. Participants cannot speak during the conference, but again, we encourage feedback via the chat option. Tonight's lecture is being recorded. If you are interested in rewatching this lecture or any of our past lectures, please check out our AHN YouTube channel. The entire lecture series is posted under the AHN Cancer Conversations playlist. Lastly, if you'd like to schedule an appointment or have any questions regarding a potential concern, please call our Hope line at 412-578-4673 or 412-578-HOPE. Our topic tonight is, does food really cause cancer? It is truly an honor to have Dr. Colin Champ here with us this evening. Prior to his presentation, I'd like to take a moment to introduce Dr. Champ and the great work he is doing right here at the Allegheny Health Network. Dr. Champ is a board-certified radiation oncologist, diplomat of the American Board of Integrative and Holistic Medicine, and a certified strength and conditioning specialist by the National Strength and Conditioning Association. He came to the Allegheny Health Network from Duke University Medical Center, where he was an associate professor in the Department of Radiation Oncology. He has an active patient clinic specializing in the treatment of patients with breast cancer and lymphoma, and has been voted by his peers as one of the best doctors in America. His research focuses on both cancer treatment and radiation therapy and the interaction of nutrition and exercise in cancer prevention and treatment. He published his first case series on the usage of ketogenic diet during the treatment for high-grade brain tumors and has been invited to lecture on his research around the world. He is the director of integrative oncology at AHN and the head of the AHN Cancer Center's Exercise Oncology and Resiliency Center at the Allegheny Health Network Suburban Hospital. Dr. Champ received his Bachelor's of Science in Chemical Engineering from the Massachusetts Institute of Technology and did his medical degree and specialty training at Jefferson Medical College at Thomas Jefferson University. He has published 99 peer-reviewed articles, wrote 4 books on nutrition and exercise, and has contributed to multiple textbooks and is a reviewer for dozens of scientific journals. Dr. Champ is a powerful voice for promoting a healthy lifestyle, diet, and exercise for the treatment and prevention of diseases. His work in this area has been featured by popular media sources, including the Boston Globe and Sanjay Gupta. He joined AHN in 2022 as an associate professor of radiation oncology at Drexel College of Medicine. Welcome, Dr. Champ.
Thank you. Thanks so much for having me. Appreciate being here. I'm going to share my slides. And that should do it. And all right. Thanks again for having me. I appreciate being here. And tonight I'm going to talk about, does food really cause cancer? In the background, that's our Exercise Oncology Center. And I've given similar talks there. So for the individuals that have been to those talks, some of these slides will be reused and the jokes. So I apologize for that. So the answer is no, food does not cause cancer. So thanks everyone for coming tonight. If anyone has any questions, let me know. Just kidding. That is a recycled joke, but that's kind of the cliff notes of the discussion tonight. And I'm going to explain why the answer is no. So an outline for what we're going to talk about, why we eat food. This is an important discussion that rarely happens when we consider food and cancer, which is obviously a hot topic. Go online, watch the news, you'll know that it's a hot topic. A brief history of food studies, the issue with epidemiology studies, which is where we get most of our data regarding food. We're going to discuss some modifiable lifestyle factors, and then we're going to discuss common sense eating for active humans. We only have, I'll try to finish this in 50 minutes or maybe 45 minutes to give us some questions. So why we eat food, for those of you that have been to the Exercise Oncology Center, you've heard me discuss this 1,000 times. You're probably tired of hearing it, but number one is to supply vitamins and minerals required for our body and cells to function. So that is vital. That is why we eat food. That's the number one reason. Number two is to acquire nutrient building blocks for our body and cells. This would be, for example, protein for our muscles, fats for cell membranes and nerves, et cetera, et cetera. Number three would be to consume non-nutritive substances. And these are substances like polyphenols and phytochemicals that stress our cells. These are the substances that can increase our immune system and potentially fight cancer. So I do think they're important. I think they're very important. And then also fiber is a non-nutritive substance that we don't digest, but bowel and our bacteria digest it, and then they make other substances that may help us fight cancer. Number four is fuel to burn. This is down on the list because most of us do consume too much fuel. And then, of course, emotional pleasure. This is important. It's important to make social connections with friends and family during the process of eating food, and also the process of growing, hunting, gathering, and preparing food is utterly vital to human beings. That's how I pretty much eliminate all my stress, or try to eliminate all my stress. So before we get into it, why we eat food, number one on there was for nutrients and vitamins. And this is a study, really a great study by Beal and Hortensian. I'm not going to get too deep into studies in this talk. I'm going to try to keep that to a minimum. But what they did was they looked at a bunch of different foods. They figured out how many calories, and that's what's on the left. And on the right here is how many grams of each food is required to get 1/3 of the daily recommended nutrients and vitamins of all these common necessary vitamins like vitamin B12, calcium, iron, zinc. This is for women aged 15 to 49. So again, on the left, this is how many calories of these different foods you have to eat to get 1/3 of your vitamins for the day, vitamins and nutrients. And then on the right is the grams of that food that you have to eat. So as you see on the top couple lines, there are things like organ meats and very nutrient dense foods. I'm not telling people to go out and eat liver and spleen. The liver's quite nutrient dense. I don't like liver, but I do try to eat it because it is quite good for you. The point of this is that we'll take liver as an example. First on the line, you only have to eat 11 calories of liver or 7 grams of liver to meet 1/3 of your daily recommended nutrients and vitamins. And if you go down the list, you see some other things on here that are not very appetizing, but fourth down, dark green leafy vegetables. From a caloric point of view, you don't have to eat much. From a gram point of view, you do see it go up to 239. You do have to eat a lot more of vegetables to get more nutrients and vitamins, just because they're not the densest foods. But again, as you go down the list, you see other things on here: beef, eggs, cow milk. A lot of these are animal-based, so those are in blue. These are animal-based foods, which makes sense. If you eat an animal, it's going to be more nutrient dense. And then you see the second light blue line down there is vitamin A-rich fruits and vegetables. And then you see other things like cheese, yogurt. Then by the time you get to fresh fish, which is still nutrient dense, beyond there, you start to see density fall off. And at the bottom, you get things like tubers, potatoes, tropical fruits would be under other fruits, chicken, unrefined grains, etc. So keep this in mind. This is a vital study. Again, this is why we eat, to get nutrients. This is a vital way to look at it. So what foods provide the most nutrients? This is another way of categorizing it, looking at overall density: iron, zinc, vitamin A, calcium, folate, and vitamin B12, which are all vitamins and nutrients that are utterly required for our body to function normally, for our immune system to help fight things like cancer and infections. And you see the same kind of list on there of foods. You see more animal-based foods. You see dark leafy greens. The more dark green on there, the more very high amounts of nutrient density. And then as you start to get down to the bottom, you see things like refined grains, unrefined grains, sorghum. Nuts are on there. That's a whole other discussion we could talk about as well. And again, this is not saying that any of the foods on here are good or bad. It's just saying how nutrient dense they are. But this is something we need to consider when we think about what foods we eat. This is a similar paper from the same authors, giving a nutrient value score to different foods based on the upper left here, nutrient ratios, looking at all kind of stuff: sodium to potassium, carb to fiber, saturated fat to unsaturated fat. Equal to that well, similar to that was vitamins and minerals. A little less was how much protein is in these foods. A little less than that was how much omega-3 fats. These are anti-inflammatory fats like DHA and EPA. And then a little less than that was fiber. And then the least of that was calories. They're not giving food high density scores if they have high calories, et cetera. And on the far right here, you see similar density. Dark green leafy vegetables are quite high, quite nutrient dense foods. Organ meats as well, fish and seafood, unprocessed red meats, eggs, etc. So again, these are things to think about when we think about why we're eating foods. It's for nutrients. So we should at least mix in nutrient dense foods. Unfortunately, when you think about anti-cancer discussions, there's always things like this. On the left is oatmeal with berries, and I could give a whole talk on oatmeal. It's a running joke at the gym. But on the left here, this is a very nutrient sparse meal. Those blackberries are great. Strawberries are okay too. But things like oatmeal, you're just not going to get much nutrient density. You're going to get a ton of calories. Not that I have anything against calories, a ton of carbohydrates, but really low nutrient density. And the same thing on the right here with the yogurt. You're really going to get high sugar, low nutrient density overall, and that's going to be in plastic, which is going to leach out into your food, which again is a whole nother lecture that we can have. But happy to answer some questions about that at the end. So where did all of the where did all the food data start? Like, why do you hear so much on KDKA that this food causes cancer, this food cures cancer? It all started with this study, which had nothing to do with food. But this was a study by Sir Richard Dahl and Bradford Hill looking at the risk of lung cancer with smoking. And this is an important study. What they found was that people that smoked had a 40 times higher risk of dying from lung cancer. So keep that number in mind, 40 times higher. So that's called a hazard ratio, which again, we're not going to get too deep into study or stats or things like that tonight, but 40 times higher risk is quite a high risk. Okay, the hazard ratio is, again, how many times higher is your risk of something happening? In this case, lung cancer, dying of lung cancer was 40 times higher. The overall risk was only 16%, but nonetheless, it was 40 times higher because the average person walking down the street has a very low risk of lung cancer. For heavy smokers, it was 3,000% higher. But the key here is a hazard ratio of 40 was monumental. From this study, they could justifiably say that smoking cigarettes caused lung cancer because the hazard ratio is 40. All right, keep that in mind. The same group, this is now Armstrong and Dahl, did a similar study looking at different foods around the world. This was back in the 70s, so very different in the 70s than it is nowadays. What they found, three of the main findings was, again, in a population study, that stomach cancer was related to fish consumption, kidney cancer was related to coffee consumption, and breast cancer was related to dietary fat consumption. However, they did not see hazard ratios of 40. They did not see a 40 times higher risk. They saw very low hazard ratios, barely over 1. And what they cautioned was that their findings may reflect some other variable correlated with economic development. And by that, they mean there were westernized people in these areas doing bad things that us Westerners do. For instance, kidney cancer was not being caused by coffee drinking. What was happening is that people that were drinking coffee were smoking lots of cigarettes when they were drinking the coffee. Stomach cancer, for instance, was not being caused by fish. It was being caused by some of the preservatives that were in the fish. So it was the chemicals causing stomach cancer, not the fish. They also said that the quality of cancer incidence data is significantly affected by economic factors, particularly as controlling for any of the food consumption variables can reduce this correlation. And that's what they saw with breast cancer. The women that were eating a lot of dietary fat were eating a lot of food in general, were gaining a lot of weight, and they had a higher risk of breast cancer. So it was tough to say that it was from the dietary fat because they were doing a whole lot of other bad things. This picture on the right is in Norcia. This is a vending machine there. It's pretty awesome. They literally have like 30 or 90-day-old aged cheese in their vending machine. They have cured meats as well. Pretty wild when you contrast what we see in our vending machines. So following this study, the group at Harvard by Willett et al. Said the Dolges showed these amazing findings with lung cancer. Let's show the same with some of their findings showing that fat intake may lead to breast cancer. So they set out to show this in the Nurses' Health Study. This was done in the 80s. It was 90,000 nurses aged 34 to 59. They did not have cancer. They filled out a ton of surveys, not a ton. They filled out a few surveys, and then the researchers tried to extrapolate from those surveys to figure out what these women were eating. And they followed them to see if it was associated with an increased risk of breast cancer. What they found was the opposite. Dietary fat, this is dietary fat, not body fat. Dietary fat trended with a lower breast cancer risk. Trended. It did not statistically show a lower breast cancer risk. It trended. So their study showed nothing. In 1996, there was a similar pooled analysis of 6 studies, over 330,000 women, and also found that dietary fat was not related to breast cancer risk. Body fat is, by the way, body fat is more strongly related to breast cancer risk. We're talking about fat in your diet. In 1992, those two dates on there should be switched. The same authors looked at fat and dietary fiber, finding that it was also unrelated to breast cancer risk. What they said at the time was perhaps we didn't have long enough follow-up. And so in 1999, they published a 14-year follow-up of those same 90,000 nurses. They had ample time at this point to see, did dietary fat consumption correlate with breast cancer? And what they actually found was, again, the opposite. They found that women who actually increased their dietary fat consumption by decreasing their carbohydrate consumption, this is very confusing, by 5%, were associated with a decreased risk of breast cancer by 4%. We can't make any firm comments from the study whatsoever. But what they did find was women that ate more fat by eating less carbohydrates actually had a lower risk of breast cancer. So again, it's the exact opposite of what they're trying to find. The more the story is, based on all of this data and other data, dietary fat does not reduce your risk of breast cancer, or at least there's not good data to show that it does. Even Walter Willett, who was the principal investigator of all of these studies, later said in 2012, as he presented to the NCI, that there was never any strong evidence for this idea, but it was repeated so often that it became dogma in the 1980s and 1990s. He was also pushing this same message. So there wasn't strong evidence for it, but it did become repeated so often that it was dietary dogma, and it remains to this day. If you look at dietary recommendations for cancer, especially breast cancer, they generally say anti-fat, and it's not based on much data. And so a group looked at multiple other dietary recommendations that are often made to individuals either with cancer trying to reduce their risk of cancer. And one of the other main recommendations has been to reduce red meat or reduce processed meats. This group published this in 2019 in the Annals of Internal Medicine. They assessed 118 articles or 56 cohorts of over 6 million participants, whittling it down to 73 articles overall, looking at dose response meta-analyses. What that means is there's a ton of studies. They basically add all the data together and try to see statistically what's going on. 30 of those studies addressed cancer mortality. 80 of them reported cancer incidence. And what they found was that reducing meat by 3 servings per week had very low certainty evidence of unprocessed meat. Unprocessed meat was associated with very small reduction in overall cancer mortality over someone's lifetime. There was low certainty evidence to show that. And there was low to very low certainty that processed meat was associated with a very small decrease in overall cancer mortality over a lifetime. And that's for prostate, esophageal, colorectal, or breast cancer. So again, I'm not making any recommendation to eat or not eat anything here. What I'm saying is that the data did not make really any strong recommendations that if you change these dietary foods, it'll have a big impact on cancer risk or incidence. And what they showed, if you look at this graph, the Y, the up and down axis is your relative risk. So remember Dahl and Armstrong, their relative risk of lung cancer by smoking was 40. If you look at these relative risk of cancer from eating processed meat, that's on the top, and then the bottom is from eating an intake of mixed, unprocessed, and processed red meat, you're at 1.1, 1.05 on the top to 1.1 the bottoms, up to 1.1 max. So again, these are very small relationships. And then the wider the gray area is on this graph, the more that studies have varied. So you want that to be very narrow. So not only is it very not narrow, it's very wide. And the more you get to servings of per week of meat or processed or unprocessed meat, they just get wider and wider. So again, this isn't saying, go home and eat 100 servings of processed meat per week. It's just saying that your risk of cancer increasing or decreasing, for that instance, based on meat consumption is very low. There's not a huge impact. If you smoke a pack a day of cigarettes, yeah, you have a 40 times higher risk of dying from lung cancer. If you eat meat, it's really unclear what that even means. Yet what we're told by the experts on the upper left here, this is from the AICR, and I'll pick on them a little bit. This is on their website to what cancer patients should eat. And it's bread, pasta, oatmeal, tropical fruits like bananas, and then vegetables on the bottom, which I'm fine with. They just don't have much in terms of calories. If I ate that on a daily basis, I would probably gain 40 pounds. But that's what they're telling patients based on data to the right here, which really shows very weak, if any, significance from eating one of the most nutrient-dense foods, which would be red meat. Now, again, I'm not making a comment of what to eat or not to eat. In terms of, this is from a big study looking at fruit and vegetable intake in gastrointestinal cancers. It's called a Mendelian randomization analysis. And similar, if you look at those dotted lines in the middle, anything to the left of that means on average, we'll say roughly on average, it reduces your risk of whatever we're talking about. Anything to the right of that line increases your risk. So when they looked at, on the top here, fresh fruit intake versus dried fruit intake, you see in general, things like liver cancer, pancreatic cancer, oral cavity cancer, there was a potential decreased risk. For gastric cancer, there was an increased risk. I don't know that I believe that. The point being is the data wasn't very strong overall. And if you look at the bottom, it's salad, raw vegetable intake, and then on the bottom right is cooked vegetable intake. And again, you see maybe an association between decreased risk. Esophageal cancer showed no association with fruit and vegetable intake. And then gastric cancer was kind of all over the map. I think vegetable intake is vital. I think they're healthy for many reasons, but the point being is none of the data is profound, right? We're not seeing a hazard ratio of 40. We're seeing in these studies barely crossing 1, right? Barely to the left or barely to the right of 1. So when people make these strong recommendations of which foods will cause or cure you from cancer, it's never based on strong data because there's not strong data. If there were strong data, it would be a lot easier to make these recommendations. So again, we return to you eat for nutrient density. And so the last slide I talked about, green leafy vegetables. Those are very nutrient dense foods. It's a no-brainer, right? It's a no-brainer to eat those foods because they may have an anti-cancer effect, but even if they don't, they're very high on the nutrient and vitamin scale, like a lot of these other foods. What we don't want to do is throw the baby out with the bathwater and not eat nutrient-dense foods to eat the foods on the bottom here that are going to lead to things like obesity, excess body fat, et cetera, which we know does correlate with a higher risk of cancer or cancer recurrence. But leave it to these two authors to look at this more statistically. This is by Jonathan Schoenfeld, who is a radiation oncologist, and John Ioannidis, who is a statistician and a physician, very bright guy, publishes tons of high-level articles, very critical of our field of medicine, especially if we jump to conclusions when we shouldn't. He went through the Boston Cookbook, looked at all the different ingredients and the recipes in that cookbook to see if is everything we eat associated with cancer. And it's a systematic cookbook review and analysis. This is the American Journal of Clinical Nutrition. It was in 2013. And this is a scatter plot on the top. It's all the different cancer sites they looked at. That's breast, gastrointestinal, genitourinary. That would be like prostate cancer, gynecologic, head and neck, lung, and then other cancers. And on the right was an increased risk of cancer based on different foods. On the left was a decreased risk of cancer based on different foods. And what you see in that top area is a almost equal scatter plot of some foods will increase your risk of cancer, some foods will decrease your risk of cancer. In the bottom, he looked at different foods. So wine, tomatoes, tea, sugar, salt, potato, pork, onions, lemons, a whole slew of things. And again, you see it, it's all over the map, right? Wine, which most places would say don't drink alcohol to reduce your risk of cancer. Yet, if you look at the studies on wine, the majority say it reduces your risk of cancer, whereas 3 say it increases your risk of cancer. Again, it doesn't mean anything. I'm not saying to drink wine or to not drink wine. Even tomatoes, there's a couple studies showing they increase your risk of cancer. Same with tea. It's all over the map. Even a tea study had a hazard ratio of 5. That actually starts to get pretty high. Again, it's all over the map, and it shows how silly looking at individual foods is, because overall there's not strong data either way. And what they found was when they looked through all of the studies looking at the different ingredients in the Boston Cookbook, most associations between foods and cancer were only weakly supported. There's a very lack of consistent comparisons. We're going to talk about that in a second. This means inconsistent definitions of exposure and outcomes. Exposure is how are you exposed to the food or the chemical, et cetera, i.e. how many cups of coffee do you drink a day? And then there's a suppression of negative findings. We see this all the time. This isn't surprising. If you have a study that doesn't show a finding, most places don't publish it, right? If there's a study that says tomatoes appear to have no increased or decreased risk of cancer, no one wants to publish that. It's not sexy, right? KDK, we'll pick on KDK just because they're local news. They need a study that says tomatoes are going to cause cancer, right? That's going to scare my grandma as she's sitting in her basement. Or tomatoes are going to reduce your risk of cancer. And my grandfather, God rest his soul, who had 1 million tomatoes in his garden, is going to show that result to all his friends. So what you saw was a bimodal distribution of outcomes. They either caused or reduced your risk of cancer, but none in the middle. In defining the exposure of the food, this is where the studies really go off the wall. And when I trained, I was always told that pour data in, like garbage in equals garbage out. If the data in is bad, then the quality results outward are going to be poor as well. So the way they would define exposure of food, and they would generally have surveys for people. So you would get a survey and say how much you eat certain things or drink certain things. Some of the studies said the highest versus the lowest amount of, we'll just stick with coffee. Coffee drinkers reduced or increased your risk of a cancer. No one knows what high or low means. Some said 5 or more servings per week versus less than 1. It's unclear how they got that cutoff of 5, right? Is 5 cups of coffee the threshold, or should it be 30? Greater than or equal 30 grams per day of a food versus 0.1. Again, how do you know what's the cutoff? My favorite, 43 drinks per week versus none. So someone drinks 43 drinks per week of coffee. Like, that's a ton of coffee. How do you compare that with none? Maybe it should be 7 drinks per week or 14, and then often versus never. And so this is why the data is just really all over the place. And even the silliness of these surveys, and we had a survey in one of our studies, and I think some of the people on right now tonight listening to this were on that study. So thank you for being part of that, because you realized how incredibly annoying these surveys are. And this is a great example of how inaccurate these surveys are too. This group of researchers who do a lot of research with vegetarians, they were looking to see what vegetarians in the United States eat. They did a survey of 13,000 Americans via food frequency questionnaires, which are the typical food frequency questionnaires that are used in these studies. That's what Willett used in his Harvard studies. They asked people if they considered them to be vegetarians. And then of the people that said yes, they went back and looked at what they ate. And 99.1% of self-described vegetarians ate meat within the last week. And that was red meat, poultry, or fish. So how can you trust any of these studies when even the vegetarians are lying? Like, they should be the most honest of us all, and they're still lying. How do you trust a study where it shows some health outcome of a vegetarian if they're actually eating meat? The other issue is that not all foods are the same. So if you ask someone if they eat meat or not, or a lot or a little, or red meat, not all red meat is the same. For instance, on the bottom left here, if you look at the fat content of beef, the omega-3 value, omega-3 is an anti-inflammatory fat. It decreases based on the number of days that cows are grain fed. I feel like at this point, this is common knowledge. Most people hear about grass-fed beef. That's why grass-fed beef is better. That's how cows' stomachs are supposed to function. They have bacteria that eats the grass in their stomachs, and it makes an ideal fatty acid composition in their bodies. So grass-fed beef is going to have more omega-3s. In the bottom right here, if you look at cows that are grass-fed, their omega-3 to omega-6 ratio is 1-to-1. If omega-6 gets too high, it can be inflammatory. Inflammatory can be like a quote fertilizer for cancer, though that's an oversimplification. You want it to be 1-to-1. In the middle there, 2/3 pasture cows fed, 1/3 grain. You see the omega-6 start to skyrocket. At that point, it's almost triple the omega-3. And then cows are only fed 1/3 pasture and then grain fed, which these are common. Cows are fed grass and they grain fed them at the end to fatten them up. You see a huge ratio of omega-6 to omega-3s. So if you're eating 100% grass fed, 1-to-1 ratio of anti-inflammatory to inflammatory fats, or you're eating I don't know what that is, 10-to-1, I'm making that up, 8-to-1 ratio of inflammatory omega-6 fats to omega-3s. How do you even compare those as the same? Right. And you see this in other areas as well. On the bottom left here, this is beef. This is in 2009. This is beef in Japan, conventional beef in Japan, and beef in the US. And this is different levels of estrogens, estradiol 17 beta, estrone, both in the fat and the meat. And you see in US meat, you see high levels of these hormones that can potentially cause cancer. Again, that's a simplification. And then in Japan, you don't see those levels. So how do you do a study from people that eat beef in Japan versus people that eat beef in the US? And obviously that's a whole nother discussion of why do we have that in our meat? But that's how we view food, which is a whole nother discussion of change that needs to happen in this country. And then on the top right, if you look at vitamin E, vitamin A, and beta carotene, again, all vital nutrients that our cells need to function, that our immune system needs to function to fight cancer. Pasture-fed animals are going to have higher amounts of all versus cows that are fed stored hay. And the bottom is also vitamin A versus 100% pasture raised on the far right versus 2/3, 1/3, and then grain fed. And then my favorite study in the world, because I love cheese, is, I don't know if that bottom part's, no, you can see it. This was a study looking at pecorino cheese, which is very high fat cheese. It's basically high fat or half fat, half protein. It's aged very long. It's high in lots of different healthy bacteria, so it's great for you in a couple different ways. Yet it's that food that all of us are told that causes cancer, right? It's high fat. It must be terrible for you, even though the data shows that's not the case. This is a study where they put a randomized study where they put the participants on 10 weeks of a half-pound pecorino. They gave them pecorino cheese to eat, which is awesome to be part of a study like that. And then they looked at different inflammatory inflammatory markers like IL-6. My window's blocking. I think it was IL-8 in the blue in the middle there. And then on the right, tumor necrosis factor. And the relative percent of each dropped significantly from eating cheese. So eating cheese that's high in anti-inflammatory fats can actually decrease your risk of inflammatory factors in your body. So again, this is legit data. This is not an epidemiologic study showing that cheese is supposed to be bad for us. Here's a study where you get half pound of pecorino, which is high quality cheese, and apparently looks like it's actually pretty darn good for us. And then this brings me to my other comment, is when food recommendations diverge with frankly living as a human being. And I'll pick on the American Institute of Cancer Research again. They recommend 10 grams of protein per meal, which would be 30 grams per day. They recommend high vegetable consumption, and they recommend 400 to 700 calories per meal. So 30 grams per day of protein and 1,200-ish calories per day per meal is quite hard as a living, functioning human being to eat and still be a living, functioning human being. Yet that's what they have on their site that they're recommending to cancer patients. The World Cancer Research Fund has a little bit different recommendations. They recommend 1.5 grams per kilogram of ideal body weight. So for instance, a 120-pound individual would eat 43.2 to 81 grams per day. Sorry, it would actually be 81 grams per day. That's a typo. And then I just pulled up someone random. The MD Anderson Cancer Center said recommends for an average healthy person eating 0.8 grams per kilogram per day, which would be that 43.2 grams of protein per day, to 1.5 grams per kilograms per day for a cancer patient. And that's kind of the typical recommendations you see in the US. So again, for a 120-pound ideal weighted person without a cancer history, apparently, because as soon as you have that, it changes, and we'll discuss that in a second, you eat 43.2 grams of protein per day. If you have a history of cancer, you should eat 81 grams of protein per day if you ideally should weigh 120 pounds. So you see these differing recommendations, like as soon as you get cancer, you're not supposed to eat foods anymore that can actually satisfy you. What I will say is this is one of many studies, but there is decent data showing that having more muscle mass and having less fat mass does correlate quite strongly with outcomes after cancer treatment. This is a study in breast cancer patients using CT scans to figure out how much fat they had versus how much muscle they had. On the far left here, sarcopenic patients. Sarcopenic means low muscle mass. That's the black line. Sorry, that is the orange line. And then not sarcopenic, which means normal muscle mass, was the black line. Individuals that were not sarcopenic, that had normal muscle mass or more, lived longer. Individuals in the middle there with low radiodense muscles, so that means muscles with a lot of fat interdigitated between. If you had more fat in your muscles, you actually had a less chance of survival. If you had more dense muscles, you had a higher chance of survival. And then on the far right there, you saw the exact opposite with fat. Higher body fat was a lower risk of survival. Lower body fat was a higher risk of survival. And that's because muscle mass in general secretes anti-inflammatory factors, a bunch of other different things as well. And fat mass increases, it secretes inflammatory hormones and also hormones like estrogen and other things that can potentially fuel breast cancer. That makes sense. There's data to support it. Mechanistically, it makes sense. Our goal as human beings should be to optimize those metrics, to optimize muscle mass, to optimize exercise. It's one other discussion, to optimize body fat. So the nutritional eating pattern that helps us do that is more important than looking at specific foods, and the data supports that. And if you look at sarcopenia, so muscle loss, and you look at mortality, this is not discussing cancer, this is discussing everyone. The further the right you go here, it means the higher risk you have of dying. And if you look at the bottom right there, we're at the 10 mark on hazard ratio. So we're not to Dahl's 40, but we're a heck of a lot higher than the 1 that we see in most of these nutrition studies. If you are frail, if you are weak, if you don't have good strength, if you have low muscle mass, you have a higher risk of dying in general. You need to do things like be active, eat appropriate nutrition, eat protein to fuel your muscle. So telling people to eat 10 grams per meal of protein for 30 grams max per day is not consistent with goals to live as long as possible, because again, we want to offset sarcopenia, and the only way to do that is by eating adequate nutrients and being active. Realistically, protein requirements, if you look at things now or versus what they were, so the RDA did recommend 0.8 grams per kilogram, which is what we had in the last couple slides based on MD Anderson Cancer Center. So for instance, for a 150-pound ideal body weight individual, you need 54 grams of protein. For a 110-pound ideal body weight individual, you'd eat 40 grams of protein. These were based on nitrogen balance studies, not real human studies. There are a few elderly people in these studies. There are a few people undergoing chronic disease treatment, et cetera. Newer data is telling us to eat over a gram per kilogram per day. And even a lot of the data, if you look, says you should eat, basically, we'll switch it to pounds here, and that's what's bolded. Basically, 75% of your body weight, ideal body weight, should be eaten in grams per pound. So if you weigh 120 pounds, ideal body weight, you need about 86.7 grams of protein per day. And that's for people with chronic diseases, people with a diagnosis of cancer, people exercising, which we should all be doing, people lifting weights, which we should all be doing. So if you're eating 30 grams per day in that setting, and that was basically for everyone. They didn't have it based on body weight. That's a low amount, right? We have to eat to be humans here. And greater than 20% of your energy intake should be protein based on multiple studies. Unfortunately, the bottom right here, most of us don't eat enough protein, especially breakfast and lunch. Women are worse than men. At dinner, men generally get enough protein, but the other 2 meals of the day are pretty poor. Breakfast really derails most people. And we can chat about that at the end if you'd like. And when food recommendations diverge with living, again, I'm picking on the ACR. This is from their website as well. This is what they consider a normal dinner, which is basically a giant bed of rice and broccoli, carrots, and a little bit of lean chicken. Again, I have no problem with the vegetables. That meal is just a basic giant carb load with very low protein. Same thing in the right here, wheat, grains, tropical vegetables. If we actually ate like this, we would have lots and lots of body fat and not a lot of energy to exercise. So I can't, with a clear conscience, recommend that to any of my cancer patients. Again, we can't recommend the foods. These are the foods lowest on nutrient density scale, right? Grains, roots, tubers, whole grains, doesn't matter. Other fruits, again, tropical fruits. Tropical fruits are a great way to gain weight. So what we did in the Exercise Oncology Center and what our recommendations generally follow, this was a study, it utilized some dietary recommendations in this study called the Diet Fits. We had individuals increase their protein to that same ratio we just discussed, about 75% of your ideal body weight in pounds, eating that in grams per day. To keep carbs under 100 grams per day, high carb foods are generally low nutrient density foods. We try to keep it simple. We did not have people count calories. That was number one on our 4 kind of points. No calorie counting, eat nutrient dense foods, limit processed foods. I don't love that term, but again, it's an easy term. Limit sugar, bread, pasta, cook and eat with your family. No snacking allowed. Don't eat in your car. Quality over quantity. So eat whole foods. Don't not eat meat. Eat higher quality. Eat grass-fed meat based on the data I already showed to you all earlier. And what we found in 3 months, individuals lost 6.6% of their body fat and increased 1.4% of their muscle mass. They were also lifting, and they were lifting pretty hard. And for you individuals in the audience, you know how hard we pushed you. But this is what I recommend for everyone. This shouldn't be a study. This should be real life. We saw quite a big benefit overall. Carbohydrates decreased by about a third per day. Protein went up from about 70 grams to 83.4 grams. I don't know that I believe that. This was based on surveys. I'm not saying people lied, but it's just easy to inflate what you actually did. What was cool was that looking at the bottom graph here, and I'll speed up because I don't have a lot of time, body fat change overall had little to do with whether you're getting chemo or radiation. It didn't matter. People that just came in and ate appropriately and worked out hard saw the changes. So that's pretty empowering message. It doesn't matter what treatment you're doing. It doesn't matter what your diagnosis is. You come in and you do the right stuff and you see the differences. Recently, very appropriate for the study, there was a large analysis of, it's called the 2026 analysis of global and national cancer burden. This was just published in Nature Medicine, big journal. It was a couple months ago. They looked at the Globocon data for 36 cancer sites in 185 countries around the world. They estimated 7 million of 18.7 million new cancers are attributable to 30 modifiable risk factors. So basically what they found was that 40% of cancers are preventable. So you're thinking, all right, what are the foods that I need to eat to prevent cancer? But what they found were the biggest factors to avoid or to mitigate, to decrease your risk of cancer were infections, tobacco, body weight, alcohol, and chemical exposures. That means asbestos, air pollution, etc. So as you see, for the biggest factors, 4 of the 5 are chemical exposure, right? Or chemical overexposure. Not that, one, I'm not saying to go smoke, but if you smoke 1 cigarette, you're not going to get lung cancer. It's obviously overexposure. The biggest other factor was body weight. So not food, not eating enough broccoli or, eating too much red meat. It's body weight. And I would argue body weight's a bad term. It should be body fat, because you can have high body weight but be all muscle. And this brings up a good issue. So we focus so much on food, this food or that food. Coffee is going to cause cancer. Coffee's curing cancer. And we ignore the whole chemical exposure issue, which is really what we should be a lot more concerned about. And it's partially not our fault. This is what we're spoon fed. The International Agency for Research on Cancer, they come out with these cancer recommendations based on different groups. 1A is carcinogenic to humans, 2A is possibly carcinogenic to humans, 2B is possibly as well, with different evidence base. And they always focus on food, some other things too. But like group 1 is processed meats. Again, what does processed meats even mean? Right? If you get a prosciutto that's processed via local salt and air from the Adriatic Sea, like, is that going to actually cause cancer in you? Or are you talking about processed meats like a hot dog with 50 different chemicals in it, or by the end of the day, you're not even eating pork anymore, you're eating a bunch of different chemicals? Whereas level 2B is things like gasoline and exhaust. Whereas there's data that exhaust increases your risk of lung cancer by 3 to 7 times, not these hazard ratios of 1. It's multiples of that. So you see the kind of issue here when they're talking about foods that are very nutrient dense, but then not commenting on gasoline engine exhaust, or things like what was going on in the background here, which happened 30 miles down the road from most of us on this video. So again, there's this weird fascination with food, and the data just doesn't hold up. And again, I'm not saying to go eat whatever you want. I'm just saying these scare tactics aren't appropriate. I mean, there are plenty of chemicals that are associated with occupational cancer, and again, these associations are very high. They're not a hazard ratio of 1.01. They're hazard ratios of 5, 10, or higher. And these are some of them. Benzene. Is benzene on here? So benzene's a good one, where benzene is associated with a lot of different cancers. Benzene's often used in food processing. So if you eat processed meat with benzene in it, yeah, it's probably a bad idea. Is it the processed meat, or is it the benzene that you're eating? It's probably the benzene that you're eating. And a good example of this as well, if you compare the US and Europe and which food chemicals are banned, purple in here is banned in the EU and also recently banned in the US. And these include beverages with brominated vegetable oils, which may cause thyroid dysfunction, neurological disorders, and skin issues. Soda and candies with certain color additives like artificial coloring, like red 3, which potentially have risk of carcinogenic effects. So we've just banned those in the US, which is great. They've fortunately been banned in other countries for a decade or decades. And then other foods in the red here are banned in the EU, but are still allowed in the US. So these are things like chlorine washed chicken. So a lot of chicken we get is washed with chlorine first, which is insane to think about. But that goes on. And again, chicken's one of these things that are recommended quite often by some of these organizations like the ICR. Meat with growth stimulating hormones or drugs. These have shown to be endocrine disruptors, et cetera. Those are banned in the EU. We still allow those in the US. A lot of chewing gum and candies, even a lot of dairy products in the US, they put in titanium dioxide, and it's potentially carcinogenic. A funny story about titanium dioxide. I didn't know what it was. I was staining grout in my bedroom because it didn't match, and I bought a staining agent that had titanium dioxide in it. So I didn't want to use it because I was worried it would be harmful, especially if my kids are crawling around on the floor. And lo and behold, it's in half the foods we eat. So a carcinogenic agent that I don't want to put on the grout on my floor is actually in the food that we eat. So things like chewing gum and candies, anything with a whitening agent. Again, banned in the EU, allowed in the US. And then there's potassium bromate. I don't even know how to pronounce this. Azodicarbonamide, which is both possible carcinogens. They're seen in pastries and dough additives. Again, banned in the EU, but allowed in the US. And then the last on here is restrictions in the EU requiring a warning label. And those are things like Lucky Charms, which everyone knows what they are, artificial coloring with yellow 5 and 6. Again, the point of these is it's hard to say if foods are good or bad for you if you're putting chemicals in them that actually do cause cancer. Right? Is chewing gum, I don't like my kids chewing gum because it's actually full of microplastics, but is chewing gum bad for you, or is it the titanium dioxide inside of the chewing gum? So those are things we need to think about. And then last but not least, before I get off my chemical high horse, this is a study I love and I hate, I guess, at the same time. These were 10,000 individuals in the NHANES data. They did food surveys to see where the calories of their food eaten in the prior 24 hours came from, whether it was at home or when they ate out. And then they did blood tests on PFAS chemicals. PFAS chemicals are potentially carcinogenic chemicals that are put in waterproofing and like degreasing or greasing rather agents. It's in styrofoam. It's in a lot of plastics. And when you put food on these plastics or styrofoam, the PFAS chemicals leach out into your food. And what they found was that people that ate out a lot, as expected, had higher levels of all 5 of these PFAS chemicals. For whatever reason, the association was stronger in women than men. And they found that consumption of meals from fast food, pizza restaurants, and other restaurants generally was associated with higher blood levels of PFAS concentration. This is not common sense. This is common sense stuff, right? This is the stuff my little Italian grandma would say. You got to cook at home and eat at home. And the best was not the best or the worst. There were significantly higher levels of the really bad PFAS chemicals in popcorn. So does popcorn have carcinogenic PFAS chemicals in it by itself? No. What happens is you pop popcorn in a package and the chemicals in the package come out into your popcorn. So again, it's not the food, it's the chemicals that are put into the food. And I'll speed up here, just piggybacking on this, a lot of our foods contain microplastics. This is not a cancer study. This was a cardiovascular study looking at heart attack patients in Italy. When they would go in and clean out their vessels that were clogged, they found PVC, polyvinyl chloride, and polyethylene. These are microplastics. And on the far right here, they found that the odds of having a heart attack, clogged artery, and the odds of dying from that heart attack were significantly higher in individuals that had microplastics in their blood in those clogged arteries, right? So if those foreign substances are collecting in your body and causing clots, what do we think that's doing in terms of our immune system, cancer, et cetera? So these are a lot easier things that we can reduce instead of trying to point out foods that show no association. 3 quick recommendations. Again, we're talking about Europe, so we'll keep talking about Europe. They look at mindful dining habits. They eat more with focus, no phones at the table, etc. Phones can be a whole nother 15 lectures on how bad those are for us. As a result, you recognize satiety sooner. They're viewed as a social event. You don't eat in the car. You did the same stuff that we told these women to do and exert BCN. Portion sizes and quality. European dishes are heavier. They're higher up on the nutrient density scale. They're the same foods that we tell people are going to cause cancer. And we tell them to eat a Mediterranean diet, ignoring the fact that most Europeans eat the foods we're telling them not to eat. And then the cook at home culture. I can't focus on this enough. You just saw the PFAS study. Grow your own food, shop for your own food, cook your own food. That's the best way to ensure it's going to be healthy. What I do, I'll talk for 1 minute. This is a question at the end of every talk I've ever given. This is my breakfast 2 days ago. I grind my own coffee every day. It's organic, shade grown, fair trade. I put in 100% grass-fed heavy cream. Again, high on the nutrient density scale. My breakfast is bone broth made with 100% grass-fed oxtail. In the middle there is greens grown in my bok choy, grown in my own garden. On the left there are carrots and carrot greens grown in my garden. The bottom there are pasture raised. Pasture raised means the chickens are running around eating bugs. There it is on the right, bone broth with kimchi. I put kimchi in there as well, fermented food. I try to use as many as I can. That meal is way high up on the high nutrient density scale. It also has dark leafy greens. It also has kimchi and spices. It has all the quote anti-cancer benefits along with high density. I try to lift weights 4 or 5 days a week. I eat a lot of berries around my workout time, usually with protein. This was my dinner the other night: lamb, tomatoes grown in my garden. Actually, that's a lie. Those were tomatoes given to me by a very good friend. Basil, 100% grass-fed buffalo mozzarella, a little bit of red wine in the bottom left there. That kale is grown in my garden, and yet it looks pretty awesome. It's about 2 feet long. Again, way high up on the nutrient density scale. Lots of anti-inflammatory, some olive oil in there. High nutrient density, high quote anti-cancer, whatever we want to call that. These are the foods I think make sense. And then this was my dinner last night. Octopus on the left. beets and beet greens from my garden, a little bit of grass-fed beef in there. Then those tomatoes and basil were from my garden as well. Caprese salad, again, very high on the nutrient density scale, plus tons and tons of vegetables. So again, we discussed why we eat food, a history of food studies, the massive issue with epidemiologic studies, what modified lifestyle factors actually do exist, and then some common sense eating. Now, again, I know these are discussions that could each of themselves be college classes. So at this point, I will stop sharing, and I will see if anyone has any questions. We got a couple minutes left.
Okay, it looks like we do have a couple questions. Our first question is a whole food plant-based diet cancer protective? I've been on WFPB for 4 years and will continue eating these foods as it has been life-changing.
Yeah, so that's great that it's been life-changing. I don't know what whole foods plant-based diet means. And this is one of the things we need to clear up in the field. We need to be clear with people that the foods I just mentioned are those are plant-based. So in that regard, I would agree, right? Most of the plate, there's a whole other plate of plants. But if you looked at a lot of the plant-based online sites or whatnot, you would see no meat, you'd see no protein at all. So I don't know what plant-based means. I do think we need to define things like Mediterranean diet, for instance. I have a lot of family from Italy. If you go and eat Mediterranean foods there versus here, you get two different answers. So I do think eating lots of plants are great. I think it probably is cancer protective. Again, the data is not so consistent, but I eat that way personally. So I agree with what you're doing. I got the questions up here now. Will the slides be available? This will be posted online. Great question here. I won't say your name. How do you feel about the cancer risk of grilling and smoking protein? So that's a great question. And that illustrates kind of the topics we discussed. There is some data that if you look at burning foods, burning or grilling any foods, not just red meat, but even if you burn fish or burn other foods, you create these chemicals and nitrosamines, et cetera, that may have some cancer promoting properties to them. So again, it's not necessarily the food, it's what you're creating. So I do generally try not to smoke a lot of meats or burn and grill a lot of meats. Now, if you eat them periodically, it's probably not going to cause any issues, and that's been shown. These are all dose response. So I do agree with that. I do think we should try not to grill and burn our foods, and et cetera. Next, keeping weight low is recommended. But since I've had chemo, I haven't been able to lose weight. So oftentimes when individuals are on chemo, they're given steroids. It makes your blood sugar go very high, and it makes you gain weight. It's a reason why I do feel overall eating grains, bread, rice, high carbohydrate foods, I don't think is great for most individuals, especially those of us that are not very insulin sensitive, which is me and most people on this call. A lot of times when you eat those foods and are on things like steroids, it makes you gain quite a bit of weight. So the nutrient density graphs that I've shown, those foods become even more important when you're on things like chemo or on medications that can make it hard for you to keep on muscle mass or keep off fat mass. Next question, what do you think about protein powders? I take a protein powder after I exercise because I'm approaching 50 and I'm very concerned about losing muscle mass. I'm kind of a tall, skinny guy, and if I don't lift a lot and eat appropriately, I lose weight. And I'm scared about being sarcopenic, which could impact how long I'm on this earth. So I do eat protein powders after workout. I use a unflavored, second party tested, organic, very pure protein powder. And that's, again, I'm doing that on purpose to get more protein. I would never use protein powders to replace meals. Meals and foods are vital. Are you a fan of supplements such as fruit and vegetable complexes and beetroot and green tea? No, I'm not. I'm not a fan of any supplements that replace food. I'm a fan of supplements that help you supplement things you're unable to get in your diet. So for instance, magnesium and potassium are very low in the soil nowadays because we've monocropped vegetables for the past 50 years. So I'm a fan of supplementing with things like magnesium and potassium that are very hard to get. I'm not a fan of supplementing fruit and vegetable powders when you could just eat fruit and vegetables. I think we have to have a very good relationship with food and a healthy relationship with food where we need to nurture it, use it to nurture ourselves, not eat it in the car, not turn it into supplement, etc. I think it puts us on a slippery slope. Next question. I'm guessing my hint water is not good for me to be drinking. I don't know exactly what hint water is, but I don't like it. Just by the way this question went, I don't like the hint water. But I don't. Again, there's not tons of data for me to support or to cite here, but there are studies showing that if you drink bottled water, every time you tighten the lid, it releases microplastics into the bottle. Microplastics made to not break down. That's why when you throw a plastic bottle in the woods, which I hope you don't, but you can walk there 20 years later, it's still sitting there. So those microplastics collect in your body. What do you think they do, right? They sit there and cause issues, right? It's like we know what asbestos is. It's the same thing. So I'm not a fan of. I don't know what hint water is, but I'm guessing I'm not a fan of it. Other question to supplements was in addition to eating healthy foods. Thanks for the clarification. Again, I don't macro dose things unless there's a purpose why. So I'll macro dose protein when I'm lifting weights because there's data that can help with hypertrophy afterwards. I don't macro dose any antioxidants because there's actually data that could be worse for you. So that would be in like fruit and vegetable types, like these green powders, etc. I really question whether they're helpful or not, and they're expensive too. So again, if you for some reason cannot get, if you're traveling through, Antarctica, sure, I would do it. But if you don't need to, I don't think the data actually supports it. I think it comes from a good place, but the data doesn't support it. Is filtered water safer than bottled water? Depending on the filter, the answer is probably yeah. You can check online, look at PFAS levels in your drinking water. It's all listed online. They list actually all kind of stuff that's in your drinking water. So I generally recommend a good filtration system for your drinking water because what do they say? If you don't filter your water, you're the filter. I'm not a fan of bottled water at all, and I'm not going to get on some environmental high horse, but I do think plastic bottles are utterly terrible for the environment. But yeah, I'm not a fan of drinking microplastics. I think, the goal should be to reduce chemical exposure into our bodies, and that's one way to do it. I know that's a bit tangential to the talk tonight, but
well, it looks like we have time for one more question, and we'll wrap it up. I think we have one.
Last question is, I'm concerned about level 1 carcinogens. What are the recommendations again there? I don't know that I am concerned about level 1 carcinogens. I don't know that I like their levels of carcinogens. The sun exposures on there. Yeah, sun causes squamous cell carcinomas or skin cancers. There is data that sun exposure is associated with decreased risk of other cancers. Do I think people should just avoid the sun? No. I think it's a simplified way of looking at things. I don't think it's based on great data. So I don't use that to guide me. I use kind of the nutrient dense discussion that we just had. There is data as well that, back to the meat question, if you eat burned meat, it may be a carcinogen. Yet there's data that if you eat green leafy veggies or fermented foods, it actually feeds your bowel bacteria. It helps offset those carcinogens. So I do think our diet needs to be a mix of multiple different foods that serve different purposes. And I do think feeding our bowel bacteria, which was number 3 on my list of why we eat, is important as well. So I hope that was helpful.
Okay. I think we had a lot of excellent questions tonight. So if there's no other questions, we would like to thank you all for attending our Cancer Conversations lecture series this evening. Please continue to join us at our monthly AHN Cancer Conversations lecture series as we focus on cancer screening, early detection, and survivorship. As a reminder, tonight's lecture was recorded. If you're interested in rewatching tonight's lecture, check back on the AHN YouTube's channel in about a week or so for the full recording. This video, as well as all of our other videos, are also available on that playlist. Lastly, we'd just like to thank Dr. Champ for an excellent presentation tonight. I know myself, I've learned a lot, so thank you for giving your time tonight.
Thanks for
Have
having me.
a good
Appreciate
evening,
it.
everyone. Bye-bye.